Hey everyone, my name is Zach Wilson. I'm a physical therapist, researcher, educator, and I'm starting a YouTube channel today geared towards the early career physical therapist who's transitioning from school into treating now. And that's a big jump. It's a scary jump. It's loaded with anxiety, uncertainty, and not just because of the COVID situation we're dealing with right now. I went through it as a student and going into my residency, and I've seen it with pretty much every single student who's gone into the career. Even if they have an external show of a lot of confidence bordering on cockiness, we're still dealing with a lot of unknowns. And a lot of that comes from what the focus of school is. Really, the truth is, school is designed for you to pass your boards. And they do that for a reason. That's how schools are measured. Their success is measured by their pass rate of the MPTE. But outside of them preparing you for that, it's really just making sure that you're confident enough not to kill anyone in the clinic. And that's a big jump then to start treating patients. And I'll tell you, the time that I first saw a patient, my very first day, I walk into the clinic, meet my clinic director, because we had a new one that transitioned after my interview. So first time meeting him, and he has a quick phone call that he has to jump on. He goes, oh, hey, that patient over there, do you mind quickly giving him some manual therapy? He's a knee patient. Okay, that's all I've got. So I go over there. I've got confidence. I did really good in my clinical rotations. I graduated with honors, went to Emory, big name, big school. I've got this. And I proceed to jiggle the kneecap of this patient and really look like I'm probably an office worker from the upstairs who just meander down and want to see, give this physical therapy thing a try. So after doing a little bit of rubbing down on the guy's knee and having some awkward conversation, I scurry back to my director and say, okay, now what? We'll go give him exercises. Okay. And again, even though I have all this information in my head, it goes out the window. And I go and give him exercises that, wouldn't challenge the 35-year-old firefighter on the table. It might challenge a 9-year-old woman who just woke up from a coma and was about as deconditioned as, say, the individuals that you find that are laying in the bed in Willy Wonka. But that's what I went to right away. There was this jump that once I actually had my own caseload, everything kind of faded away. And that's not an unusual experience for students to have. And so what I really want to be able to give in this series of videos that I'm going to start doing for you guys is helping you navigate that jump from physical therapy school to the clinic. But what I'm really going to emphasize is not on the specific techniques, the exercises, the manual therapy. There's a lot of smart people out there who have a lot of great information on that. What I want to focus on is something that we really don't get taught in school, and that's critical thinking. You might think, hold up, you telling me I don't know how to think? I'm referring to biases and heuristics. I'm referring to our confirmation bias, our theory-induced blindness, availability heuristic, all these things that influence our emotions, that influence what exercises we choose to do, what information we choose to read and adopt in our clinical practice, the reasons why we see that typically clinicians are way behind in the research, or why people cling to evidence that was maybe the gold standard 20 years ago, why we see modalities still used in excess in a lot of our clinics. And there's science behind this, but it's rarely taught to us. So please subscribe to my channel, check it out, drop me a line if you have any questions or if there's anything that you want to know more about with respect to biases, heuristics, which is a fancy term for rule of thumb, and clinical decision making. There'll be a series of videos on that. I've got content at my website, ZacharyWilson.com. The aim of this is really to empower you all to be able to find the evidence that's going to make your clinical practice elite, to be able to identify where are the gaps in your clinical knowledge and where do you have opportunity to grow. I look forward to shooting some more of these videos and working with you guys. Thanks for tuning in.